not to mention their supplies are running low, including with chlorine, and people like Sergey and Boris keep coming to the CTU when they're almost dead and they can't be helped, which is really frustrating, and it makes it really hard for the health workers to care for their patients. So then the community start to think that CTU doesn't provide quality care, which is true, but then look at what the healthcare workers are dealing with. So then they don't come in until they're almost dead, and so on. And then the health workers start to hear that in some places, the communities are even attacking the health facility because they weren't happy with the care that they were getting, including how the health workers were dealing with the bodies of their dead patients. So yeah, Sergey got really lucky going to the CTU when he did. But what if he just hadn't gone? If Sergey had gotten symptoms at night and his neighbour's wife hadn't woken up, he probably just would have died at home. Or if she had woken up and she saw him, but he still owed her money and she didn't want to get cholera and she didn't think he was going to make it anyway, so she went back to bed and Sergey died in his sleep. Or if she did try to help him, but there wasn't an ORP nearby, or maybe she hadn't heard of it, or maybe they went there, but when they got there, they were closed, or they were out of supplies. So Sergey dies again. Or maybe Sergey had refused to go to the health facility because he lacked the energy to leave the house, or maybe he'd heard bad things about the way they treated the patients. Or perhaps he'd gone before when he'd had an injury, but they'd made him wait several hours and then they didn't have anything for pain because they didn't have medicines, which they often don't. Or maybe he didn't want to go because men just don't go to health facilities. What did his neighbours talk about him? And really, he doesn't have the spare money for it. Or he didn't go just because staying at home and living through it is what people in his community do because they have diarrhea and vomiting more often. And getting sick isn't uncommon, it's just part of life. That's a real shame for Sergey. By the time Sergey dies, and then his neighbours get sick as well, they know that they should go to the hospital and that the ORP is open. At this point, the outbreak is officially declared and the services are subsidised. But when their baby gets sick at night, it's really hard to get to the health facility and the ORP is closed. And they sold their ORS sachets last month to buy baby formula, which they also mixed with unsafe water that they got from the busy water point in their village. So they decide to wait till morning and see, because the closest health facility is a long walk at night, and they don't have any other transport, especially because the motor driver that drove Sergey also died. By the time it's morning and they can go, it's too late. We are hoping that you can help us to redesign the